Access to affordable health care has long been a concern in the U.S. The problem is especially acute in rural areas where there is a critical shortage of doctors. To treat the problem, the OSU Center for Health Sciences is training our state's first wave of physicians specializing in rural medicine. Almost all hail from small Oklahoma towns, and they're learning to practice medicine in a way no doctor has before.
Doctor in training Shanae Adams and nurse in training Serena Clinton lean in close to learn a technique for palpating a patient's abdomen.
Halfway between thumb.
They're the first medical students and members of other medical professions learning to collaborate on a patient's diagnosis and care as soon as their clinical training begins.
Just breathe normally.
One physician, one person just can't do it all. And the patient needs a team.
OSU Center for Health Sciences Associate Dean for Rural Health, Dr. Bill Pettit, says having input from everyone involved in a patient's care is the future of medicine. It's also a big change from the way things have been done.
Back in the old days, I went to school, we were the doctor, you were the leader, you made the call. And we know now that that doesn't always work in 2012 and beyond. So we need to get a better relationship between physicians, nurses, surgery techs, pharmacy techs. So this is a exercise where we'll actually, in partnership with either a Tulsa Tech or Tulsa Community College, set up exercises where the different professions work together.
In this first collaborative care exercise, each bed has a mock patient suffering from one of a wide range of ailments or injuries. Everything from a broken hip.
And of course you've looked to see if there's any bruising or anything that she could have hurt during the fall.
To a possible heart attack.
So that side has like a harsh sound to it on the pulse.
Third-year medical students and nurses in training work together to assess the patient's condition, then come up with a treatment plan. Serena Clinton is a nurse trainee.
Well, I think it can improve patient care because the nurses are with the patients around the clock, and I think we have good vital information for the physicians, so it's nice to be heard.
I think that instills a little more confidence in the patient, because they know everybody's working together, bringing ideas.
Pettit says learning to work collaboratively will be especially important for OSU's first class of medical students training to be rural doctors. Adams agrees.
I think in a rural setting, nurses are, especially if you're nurses from that town, nurses are your best resource. They know the culture, they know everything. They can just bring so much to your patient interaction.
Adams grew up a country kid in Shawnee and Wellston. She wants to practice medicine close to home.
We don't have a doctor in Wellston. The closest one is in Chandler, which is 15 minutes away, and I don't know how long he's been there, but it hasn't been that long. So to see that need of these people who need medical care and don't have the money to drive or the time, because farmers are busy, it just made me realize what a need there is for doctors in rural Oklahoma.
Joshua Priddle from Martha and Jennifer DeRoy from Ponca City feel the same way. They're members of the first class of OSU medical students recruited from rural communities to be rural doctors.
The rural medicine track attracted me because I am rural. When they said that there was an option to do medicine in the rural and be trained that way, that was pretty exciting.
There's 13 of us that are starting. This is the first year for it. And our focus is just to get those primary care physicians back out into rural Oklahoma.
What other cultures might you want?
Training doctors from rural areas to work in small towns across the state is seen as the first step to curing Oklahoma's critical shortage of primary care physicians outside urban areas like Tulsa and Oklahoma City.
We actually always ranked or have ranked at the bottom or near the bottom in both practicing physicians and primary care physicians. And primary care generally being family medicine, general internal medicine, pediatrics, and obstetric gynecology.
What are we going to give this patient tomorrow?
By the time these medical students graduate, the shortage of doctors in Oklahoma's small towns could be even more critical.
In 2014, that they're estimating that probably there'll be a lot of people retiring since digital medical records are going to be required, and so that will just make our shortage even greater.
But even before they graduate, they'll be working in small hospitals across the state.
We're creating rural residencies. We have now in Tallahena, Tahlequah, Durant, Enid. We're doing discussions elsewhere. What we know from data is that where you finish your residency is likely where you'll stay, and not only that, You'll be retained there.
More likely he's going to get a fibrinolytic and then a trip to the cath lab at a remote site.
The students tell us they know practicing medicine in rural areas will be a challenge. Often there won't be a hospital nearby. But each feels advances in telemedicine and knowing how to work collaboratively with other medical providers will keep them small-town Oklahoma doctors for life.